Welcome to Spotlight Community Service. I am your host, Joseph Patrick Fair. Stand by to learn all about your community. Oh, and welcome to another episode of Spotlight Community Service, where we shine a light on heroes and organizations that make our community a safe and better place. I am your host, Joseph Patrick Fair. Today we have an incredible guest, Dr. Julie Sorenson. I'm going to turn the mic over to Julie, and she's going to tell us her credentials and her background.
Thanks, Joseph. My name is Dr. Julie Sorenson. I'm a doctor of marriage and family therapy. I have a licensed professional counselor. I don't want to say I am a school counselor, a teacher, adjunct professor. So I've kind of had my hat in lots of arenas in the mental health area. I've worked in the school systems as a school counselor, as a behavior interventionist, as a teacher. I worked K through adult education. I've been able to work with gifted students and alternative students, and you learn something every day from your students. And currently, I'm an outpatient therapist. I have my own LLC, a Fresh New Start Counseling LLC, but I work as a 1099 person for the teletherapy group, and I've been there since 2020. I came there after COVID was difficult in the school systems as a school counselor, and which is why I wrote my first book. I was talking to numerous families about the anxiety that they had related to COVID and having to feel isolated and anxiety and just sad. And so I was like, I'm working with all these people, and we're talking about the same things. I could probably help a lot of people. So I wrote my first book about COVID and providing coping mechanisms to help people that were dealing with anxiety. And during that time, I decided that I needed to have more time because I was in the middle of my doctoral program. And I was starting my dissertation, and so I stepped away from the schools and started working in a private practice where I see clients from, 8 to maybe 70, 75. Now I'm really focusing more on 17 on up, not seeing as many younger people as what I used to. And there at the practice, I provide therapy for people struggling with anxiety, depression, trauma. I do a lot of trauma-based things, and I use EMDR, which is amazing, like just watching people come in the first time with all the trauma, and then once we're able to put those safety devices in place and start using EMDR and seeing them have a decrease in anxiety, increase in their mood, and trying to figure out, okay, well, now that I'm not living with anxiety, what do I do with this space, And so finding that time for more self-care is amazing. So before I quit the schools, I was offered to be a part of an amazing suicide prevention team where there were different categories, and I was kind of heading up the CISM, Critical Incident Stress Management. And we were creating an executive summary with a lot of amazing professionals in all reams of the industry. There was some police, there was some healthcare providers, there was some EMTs, there was therapists, there was people from DHS, people from Michigan Department of Education, just lots of different areas. And we were trying to have the policies and procedures the same throughout the state of Michigan. For suicide prevention. And then the Oxford school shooting happened while I think it was like on the table for legislation to look at it. And so they took it off the table and I believe added school safety and youth mental health. However, I wasn't a part of that because I was knee deep in my dissertation and I needed to focus on that. And so during my dissertation, I decided, because of my experience working with these individuals, that I think that we need more resources for suicide prevention. And because of that, I created these resources. Let the Sunshine In from the Black Hole is a children's book, and it uses personification to be able to allow children to talk about a difficult subject like suicide. And then the teacher component for suicide prevention has history of suicide, it has trends, it has warning signs, it has scripts so that educators can contact families and let them know how to tell the family that their child has suicidal thoughts. It also has lesson plans that coincide with the student component. So these books can be paired together or they can be separate.
Excellent, excellent. Let me review back. You've done a lot of things in mental health, and you've worked really hard, and your focus in therapy is to help people. And suicide prevention is something that you saw during COVID. You figured out writing these books for the teachers and the kids would make it simpler to apply that therapy through the book and in person and whatnot. You've done a lot in our community to help with mental health, and my hat's off to you.
Thank you.
All the
Thank you.
hard work that you've given the community. I would like to have just a quick little discussion about how you went transition from hairstylist to doctor of marriage and family therapy. It's kind of a fun story if you could tell that.
Yeah, absolutely. So when I was in high school, my high school guidance counselor told me that I was not smart enough for college and that I should just do hair, which it's not just doing hair. Like, I had so much fun doing hair, and I did a lot of different things within that industry as well. I did photo shoots, we did hair competitions, I managed a salon, I owned my own salon, and of course my hair clients became like family to me. You know, we were just very close. I had a very good clientele, and I was very happy in that industry. I went around to different salons teaching hairstylists how to sell products, because if you're going to spend a lot of money on your hair, you might as well get the good products to go along with it. But anyways, you know, she just told me that I wasn't smart enough for college, and so thankfully I'm not one of those people that let that be. You know, I could have been like, well, I'm never going to be able to go to college. But when Columbine happened, and I decided that I wanted to try to homeschool my son so that I didn't send him off to school, and then realized that that would not be a good idea. We'd end up killing each other. And so then I sent all of my kids through the public school systems, and I was very happy with that. And I decided to continue, though, on with my degree, and that I wanted to be a teacher, and that I thought that it would just be so much fun. But at the time, they weren't hiring. When I graduated, they weren't really hiring any teachers. And so I kept looking, and then finally I did find a position as a third grade teacher, and then I did Title I, and I did preschool, so I was in different grade levels. And I just didn't feel fulfilled, so I decided to go back and get my degree as a counselor. And one of my professors suggested that I get a dual degree in counseling, education and counseling psych, so that I could be a school counselor with all of my experience in the school systems. And so when I graduated with my master's degree, I started out at Portage Community High School, which is an alternative school. I was an outpatient therapist there, and working for the Community Healing Center. And then from there, I went and I became a behavior interventionist at Comstock Schools, and Comstock Schools have my heart. I mean, those students taught me so much. I just thoroughly enjoyed the time that I was there. And I worked K through adult education. So I definitely had to have many different hats, you know, a lot of diverse population, and was able to connect with the students. It's all about building that relationship with the students. And so then, you know, when COVID did happen, and I needed to finish my dissertation, I was like, I just can't work full time, you know, can't work full time and do my dissertation. And so when I went into private practice, I decided that I was going to kind of scale back my hours. I only worked 3 days a week. But in the meantime, I still was doing hair. I still was an adjunct professor at Western. I taught teachers how to teach social studies in the classroom with a multicultural component. So it was kind of cool that I would be working with like kindergartners, through fifth graders, and then go and work with college students. So there was that diverse age group that I got to work with, and so I did that for several years. I also taught creativity in the classroom, which was a very fun class, I think. And then finally, I was like, okay, I'm just doing too much. So I, worked just in the private practice, which right now I work in the private practice, and I write books and I write articles. I have a blog for the teletherapy group. I write about relationships and parenting and just mental health issues. And I do that weekly. Sometimes it'll be a couple weeks and, I need a little break. I have writer's block or something like that. I did forget to mention that through the process of all of this, I did go and work at Vicksburg Public Schools as well, and that was a great experience too. And I became internationally trained in CISM, which is critical incident stress management. So for about a year, I was an on-call consultant for the ISD in Calhoun County. And so if there was a death or some type of a tragedy in the school, then I would help get the grief counselors to the school and kind of coordinate all of that, find who was available. And so that was a very interesting process. It's definitely sad because we've lost somebody in the community, but being able to get all of these wonderful people who are volunteering their time to come and assist these kids who are struggling. And obviously, when you're dealing with critical incident stress management, it is not therapy. It's a way for people just to kind of talk through the shock that they're feeling. And then talking with the teachers and the school counselors and saying, if you're noticing that this is continuing to upset these students and they're struggling, then that's when, a referral to a mental health provider would be important.
Yeah, excellent. You've done a lot of things in community service. On the mental health side, you've seen a lot of modalities. You've been on the teaching side of it. You've been on the application side. For people out there watching, people like Dr. Julie Sorenson are doing a very important job, along with police, fire, and EMS, for public health and for improving the quality of life for people in our community. You should be very proud that you come up at a second's notice to manage that team and help people. If you don't mind, maybe we could pivot a little bit to your book. I believe there's a lot of people that could get a lot of value out of both of those books. Often when I have authors on, I'm an author also, but often when I have authors on, they want to know about the creative process, developing materials. Maybe you could draw us a little picture how your creative process works.
Well, like I said, my first book that I wrote is called A Nasty Virus Struck the World, So the Drafts Stay Home. And that was written because of COVID and everybody feeling so just anxious and isolated. And so I was talking to people all day long, and they were all saying the same thing. And so I wanted to make sure that I could help them learn coping mechanisms. And I thought, well, if I'm talking with all these people, then what is a way that I could reach more people? So I decided that I would write a book. And so the characters for my suicide prevention book actually came from that first book. There's a few more that have been added into the book. And so what I do is I go out on my paddleboard and I think about, what do I want the characters to look like? What do I want their names to be? What do I want to talk about? And when I was working on the suicide prevention book, both the student book and the teacher book, it was very difficult, because I was trying to get my mindset into somebody who was struggling with depression and struggling with these thoughts of suicide. And not everybody that struggles with depression has suicide ideation, but I was trying to get myself in that mindset to be able to really get good content for my book, because I wanted to be able to make sure that students who were struggling could relate, also students who had a friend who maybe was having thoughts of suicide would know where to go and who to talk to within the schools. And then I thought, okay, well, if I'm creating this book, I think it would be good to be able to have lesson plans, and sometimes it's hard to ask somebody if you're having thoughts of suicide. However, if you do ask somebody if they're having thoughts of suicide, that doesn't plant a seed in their head. If they're already having the thoughts, they're having the thoughts. And so it's important to be able to teach people how to ask that. So I thought, well, it would be good to have a teacher component. So the teacher component talks about trends, it talks about warning signs, it teaches teachers how to ask if somebody's having thoughts of suicide. It provides resources, where to go, resources to give to families that have kids that are struggling with suicidal thoughts. It talks about scripts on how to ask people if they have thoughts of suicide, and the lesson plan, so there's a lesson plan that coincides with the student book. So when the teachers are teaching suicide prevention to the students in the 3rd through 5th grade cohort, this one is specifically for the 3rd through 5th grade cohort. And then my plan is to write a book for middle schoolers and high schoolers, and then do an addendum on the teacher component so I can add lesson plans for that as well.
No, that's excellent. Resource like this, very valuable. If I was teaching school and I had this issue, I would want a go-to method to know how to handle the process. Should be very proud of those books, and people should go out to Amazon and look you up and pick up those books, because they're a valuable resource. Have them for that moment when you might need them in
I
life.
do also want to say, sorry to interrupt, Joseph, but they are research-based, so
Yes.
they went through the IRB process. My dissertation was based completely on the creation of these books, and then I had to have educators look at them, read them, see if they would be helpful in their classrooms as well. So it's gone through the IRB process.
Hard scientific facts put into a story that's been peer-reviewed by your organization and validated, which is probably very satisfying to you to get that validation on there, that your peers see the value that you see also. Yes, go out and pick up Julie's book and read it, and you can hopefully help somebody someday with that. I would like to ask a little bit about how you get into the mindset for writing, and what does a day of writing kind of look like to you when you take a day to write?
So after I get on my paddleboard, unless it's winter time, in the winter I just sit on the couch and start writing. But I just start writing, and I do free flow writing. I'm not really worried about punctuation or spelling or anything like that. I just write, and then I go back through it and I look at it and I organize it, and then I look at the punctuation, and I look at the grammar, and I look at all of the things that are necessary in the completion of a book. But I feel for me that I just can write better if I just sit down and I write. And I'll sit down for 8 to 12 hours at a time and just write until I'm just too tired to write anymore, because I just love it. Obviously, I have to do a lot of research to make sure that the books are solid, that they're informative, that they're real, the real issues that are going on. Just like when I write my articles for my blog, I don't just, I have to do the research first to make sure that it makes sense. And then sometimes when I'm writing articles for relationships, mental health, and things like that, I also look at what are the trends, what do people want to know, what do they want to learn. Or I'll even go out on my social media and I'll say, hey, I can't think of something to write about. Can somebody give me some ideas?
That's beautiful, by the way.
Yeah.
Yes, that's beautiful. My creative process is similar. I can't go 12 hours. I can go about 3 hours, and I'm completely exhausted. I do, don't let me put words in your mouth, but I do think that you're having a similar thing. What you're doing is getting your mind in flow, and you're kind of letting go of criticism, and you're letting the art kind of come out on the page, and see where it goes and see where it steers you, which is a super exciting experience for me also. And then afterwards, you go back and look at it. And then in my case, a third of it's really good, a third of it's okay, and a third gets cut out.
Yeah.
But it's good that you got that third or even that 2/3. And yes, it's great to have that ability to get a flow and get a enthusiasm. I think there are people out there that want to be writers, but they can't get into enthusiasm. And then enthusiasm kind of sparks that creativity, and then that creative gets that thing flowing. And then you have to, I hate to say it, trust in God or trust in the process that something valuable will come out on the page. But thank you for what you do.
I also think it's important to note that I have had lots of people like looking at my book and doing some editing. I was fortunate that my dissertation committee for these books helped with the editing process. I had a wonderful person from Western Michigan University that also had her eye on the book, Kim Ballard, fantastic, love her. And she was a part of the writing center at Western for years. She's since left, but she also kind of helped with the editing process. And so sometimes you have your books and you have your materials and you look at it and you look at it again and you're still going to miss things because you're just like in it, you're submerged in it. And so being able to like hand it over to somebody else and have them look at it and be okay to take that critical feedback, you know, because sometimes the feedback, you don't want to hear it.
Correct. The courage to listen to it makes it better. And often in my books, it could go through 4 or 5 people, and then I could have beta readers. And often it brings a richer book to the market.
Yes.
It could be just a skinnier book, but they just reach richer. It's got more dynamics to it, and the more people you get in there. And then often somebody will give you one little key thing that's a clicker at the end of that chapter that starts off the next one. But yes, great. You are doing that writing very scientifically, and your creativity is beautiful.
I do want to talk a little bit about my illustrator for these 2 books specifically. Yeah. I met her. My first book, I had a illustrator that was an art teacher, and you know she was in the midst of working in the schools with COVID, and so she wasn't able to continue on with some of my other books. So appreciate her creativity, but my illustrator that I have now, she is from South America. I met her on a Facebook page and just said, hey, you know, I have some ideas for some books and looking for an illustrator. And I think she's 20, maybe 2 right now. I don't know, but she lives in South America and she cannot speak English. So she asks me just to email her back and forth. She says she doesn't want to do like a Google Meet or a Zoom or anything like that because she says she's able to like understand better through writing. And it's just been an amazing process. She's absolutely fantastic, and I'm so lucky to have found her. And she hits the deadlines, and she's, you know, envisioning what I'm wanting to put out there. And you know, there's not really been many illustrations that I've had to have her edit because I've just been so happy with her products. So I'm lucky to have met her.
You found somebody in a synergy, and their artistic thing matched your creative thing, and it flashed. And I did not have that luck like you did. I had 4 illustrators before I got the right cover for my last book, but you got lucky right on the first one. And that's great. That's great, by the way. That's super that you got right to the right. What advice would you give our viewers if they wanted to write a book or creative resources to help the community? And anything they may fear, how would you help them get past that?
Well, I think that when you're fearful of something, but it's something that you want to do, that you need to just take that risk, because the worst thing that can happen is you'll end up with a bad product, or you know, nobody will be interested in it. But at least you took that risk and you got out there and you tried it, because it's better to do that than to have regrets of, well, I wish I would have done this. Or so I feel like that's the first thing. And then just to believe in yourself, even if you're having negative cognitions and you're like, I can't do this, I'm not smart enough for this. I think being able to learn how to turn those negative cognitions into new beliefs. So I didn't say positive cognitions, right? But new beliefs, like I'm capable of learning to see that I can make this happen. But you also have to be self-disciplined, and sometimes your creations could take years and years. Maybe you set it down and you live life and then you come back to it later. But you have to believe in yourself and you have to have that self-discipline and you have to want it, because I think if you don't want it, you're going to find the excuses. But if you want it, you're going to find every reason to make it happen.
No, you're exactly right. You got to want it. You got to understand your why, and you got to understand what impact you want to make with the reader. And I believe anybody can bring a good book to the market if they have that and a lot of patience, because writing can often take, like you said, these processes where the creativity flows and it ebbs for a while and it flows and whatnot. But yes, your advice on writing is beautiful. What would the big picture dream be for these resources if we could enable the big dream?
Well, my big dream, because I only think big, is to be able to get these resources in the hands of every school in the United States, every school in other countries within the 3rd to 5th grade cohort. And then also then for me to write a book for middle schoolers on suicide prevention, and then for high schoolers. Obviously, I'm not going to be using personification, in the older grade levels, but I'm going to try to make it like age appropriate, and then create an addendum for the teacher component so that it's got the lesson plans in that. Then, continuing on, I would like to also write suicide prevention books for college and maybe even for veterans as well. So I have a big vision, and I just am excited to see people buying these books, because my hope is not to make money off of them, because you don't really make a lot of money when you write a book. But my hope is to be able to decrease suicide, because suicide is the 2nd leading cause of death, and it's increased 52% since 2021, according to the CDC. So I think if we can figure out ways together as communities to come together and help provide that education and let people know that it's okay to say I'm not okay, and it's okay to ask for help and know where to go to. So with the student book, it talks about different people that you go to within the schools, that you can go to within the schools to be able to get help if you yourself are having thoughts of suicide, or if your friends are having thoughts of suicide. Because sometimes when young people are having those thoughts, they're going to go to their friends. Well, that's a lot for a little person to hold, right? And so making sure that everyone knows who that they can go to, who they can talk to, so they're not just holding on to that themselves. And I think the stigma surrounding mental health has decreased, which I'm so happy about, but I still think that there's a stigma out there, and I think talking and having authentic and real conversations to allow people to say, you know what, it's okay not to be okay. It's okay to say I need to find help. And I think knowing where to find help, going on Psychology Today and typing in your zip code can help you find a therapist. I also think that it's important that if you don't like your therapist, to shop around. Because if you don't like your tennis shoes, right, you're going to shop around. You're going to find ones that fit. And so you have to find a therapist that's going to be the right fit for you, that you feel like you can connect with, that you feel that you're not going to hold back, that you're going to share with them, those details of your life that you don't want to share with anybody. And it's okay to go a couple of sessions and be like, this isn't a good fit for me. I need to find somebody different. I think that's so important.
Excellent. We were talking about Spotlight Community Service and public health, and I would like you to just give us a short suggestion on what people should do. Call 988, or what a family member should do if they were to come home from work, one of their family members is suicidal. Can you maybe give the people at home a little advice on what the next step should be?
Yep. So if you are having thoughts of suicide, or if you know somebody who's having thoughts of suicide, encouraging them to call 988. 988 is open 24 hours a day, 7 days a week. You can call, you can text. There's somebody on the other end of that phone or that text message that's willing to listen to you and actively listen to you. If you're in imminent danger, then it's important to call 911 and go to the nearest emergency room.
Excellent advice for our people at home. This is Joseph Patrick Fair for Spotlight Community Service. Thank you for your time. Thank you for listening to another episode of Spotlight Community Service. This is Joseph Patrick Fair signing off.